So, how do you prevent that marathon or that runner's heart attack? And so, this is Diamond Fernandez here with the Hartford Clinic, your leaders in heart health. And today I want to talk to you about how you can prevent that marathon or runner's heart attack. Firstly, we always hear of that person that ends up with a heart attack and they were a marathon runner or a runner or super. The answer to that question is they have underlying disease. And so a lot of people, I think there was a study that just came out now, and I want to talk about that, is that 28% of the people that had heart disease, like had a heart attack during a marathon, actually had underlying disease, meaning that they actually had underlying disease that was present that didn't manifest itself. So they might have had some symptoms or things that warning signs that might have been amiss. So that's 1 in 4. But what about the other ones, and what can you do? And so, and this is why I hate stress tests, and I love them if we're using them for the right ways. But people think, okay, well, I see a cardiologist, I had a stress test, and everything seems to be okay, and I got a clean bill of health, and it looks okay. And so what I do not like about that is that 70% of heart attacks occur with plaque ruptures, and that's very vulnerable. That can happen during, especially running or marathon. And when you run prolonged period of times, your heart actually gets ischemic. You're actually putting a stress on the arterial wall, and so it's important to minimize that stress. But firstly, it's important to understand your true risk. And this is where one of the tests that we do in our clinic to look at the artery as a muscle, not a pipe, is very important, because many people think that artery disease, and that's why you can see a cardiologist and get a clean bill of health and still down the path of a heart attack. And I just don't like that. So the stress test is not a good test to do to see to prevent heart disease. Now, it can tell us if you're okay enough to exercise, but it doesn't tell us the heart attack risk. So let me talk quickly about the stress test. Stress tests are good to show advanced stages of disease. So if you have advanced stages of disease, that's what a stress test is good for. If you do not have advanced stress disease from a stress test, then this is where I hate what doctors say, is that, look, everything looks fine, your heart's fine, just continue, go run a marathon, you're completely fine. And that's wrong. It's important to understand arteries as a muscle, not a pipe. And make sure that you understand the function of the arteries, the risk of a plaque rupture. Those are very important things to get done to see where your risk is. So I know we're in running season, I know we're in marathon season, right in the heart of it. And it's important for these that are there to understand where your heart attack risk is, because unfortunately, no one's invincible. So it's important to understand where that risk is. And so that's where I wanted to talk about this last study that was done about the marathon and that way. So I could talk all day long about this part of it. So again, this is Diamond Fernandez with the Hartford Clinic. Make sure you hit the subscribe button above, and we look forward to helping you live happier, healthier, and longer.